Okay, I think we're ready to get started. I think so. Okay. So, good morning, everyone. I'm Scott Gardner, President of the Wyoming County Chamber, and thank you for coming to our conversation with Wyoming County public health officials today. We have with us Dr. Greg Collins, the Commissioner of Health, Laura Paolucci, the Public Health Administrator, and Steve Perkins, the Director of Environmental Health for Wyoming County. I'd ask everybody to make sure that your microphones are muted so that we can eliminate or try to eliminate any background noise that we have. I'll be moderating the conversation and managing the participant room. I'd ask you that if you have questions coming up or during that, you put them in the chat room, and then towards the end, we will start to read the questions, and that'll give everyone a chance to also review them while they're having conversations. And then we can see if some of the questions are similar so we aren't duplicating answers. Let's see. I am going to change the screen now. To that and put it on speaker view. So whoever's talking, that should be between the two of us. It'll shift between our guests and myself. All right. I don't know if you want to say hello to the folks in the room. Laura and Steve and Dr. Collins, you want to just say hello quickly, check in with everybody, and say a few words if you'd like.
Yeah, good morning. This is Dr. Collins. I want to welcome everybody for taking time out this morning to join us for this webinar or town hall. And we appreciate you taking the time, and hopefully with our dialogue this morning, we can answer some of your questions, maybe not all of them, but as many as we can, and hopefully give you a little background on what has evolved over the last couple of months, where we are at now and where we think we might be heading. On my left, I have Laura Paolucci, our Public Health Administrator, and right, Steve Perkins, our Environmental Health Director.
Hi, everybody. Welcome. And I appreciate everyone's time being here today. Certainly it's proving over the course of the last couple of days or a week or so that reopening is going to be a lot more complicated than closing down was. And I think this sort of dialogue gives us a chance to talk about questions that people have and make sure there's good and reliable information out there. Having said that, I expect some questions are going to come up today that we may not have the answer to. Scott, I would ask for your help to assist us in kind of bookmarking those questions and give us an opportunity to find additional information for the benefit of the participants today and your reopening plans. So Scott, if you could help with that, that would be great.
We will do that and help you out. And we should, if all goes well, I'm going to be able to have a copy of the chat, which is why it's important for people to put their questions in there. People can ask questions. If it works out well, we may be able to do some live questions. It's a little trickier to do that, but the written questions seem to work out pretty well. And then we have a recording of what those are. So,
yeah, good morning, everyone. This is Steve Perkins. I'd like to thank Scott for putting this together. We've been talking about this for a few weeks, and we thought this would be a good opportunity for everybody to be in a central room, so to speak, to ask questions, and everybody gains something off of those questions and answers. Again, thanks, Scott, for putting this together, and hopefully it proves to be as beneficial as we hoped.
All right, thank you, Steve. If we want to start out here, and we're going to hope to keep this to about an hour so that we can keep it manageable. And I know, Laura, you're expecting a very important phone call, so you may jump up during this, and we understand that's very important. So if it happens, take as long as you need, and then we hope that you can come back in. But if that happens, we understand.
So wait a minute. Now I feel moved to disclose, everyone. My son is been shipped to the United States Marine Corps boot camp at Parris Island, And I'm told as a new Marine mom to expect a phone call on his day of arrival. So if I jump up, that's what it's for. Nothing else besides that is more important than this. So thank you.
That's absolutely true, and that's why we're all very proud that he is enlisted in the Marine Corps, and thank you for that upcoming service for him, and we understand why you need to run. Let's start out, if we can. One of the things that we had on the agenda was status of Wyoming County's reopening process, and I know that you've been managing this very well. A lot of it might seem behind the scenes, but I know that, Laura, it was on your radar screen in February and maybe before, but I know that you were talking about it in different meetings we were at very early on about, what might be coming, what this might look like, without really any forecast about where we would be today. But you were making preparations and having very thoughtful engagement with your health professionals at the state level, at least. I knew that. And I wonder if you could give some historical context about what happened in February or earlier, and then what the county did as we move forward into it, and then where we are today and what we might see going forward.
Sure. And so, the timeline, it's funny, it's written on one page, and the amount of ground that we've covered since January 8th, that was when the CDC, the Centers for Disease Control, issued the first health advisory regarding a pneumonia of unknown etiology in Wuhan, China. So that was the very first that we heard. It hadn't even been named at that point. And in February, but in New York State, we began our dialogue with local health officials statewide and the New York State Department of Health to begin discussing what it looked like, describing steps that were being taken on a state and federal level, mostly around travel restrictions at that point. On March 1st, the very first positive case was announced in New York State. On March 7th, the governor declared a state of emergency. On March 15th, Wyoming County, the chairman of the board, Jerry Davis, declared a state of emergency. On March 16th, schools were closed. And on March 17th, Wyoming County received our first positive report of a resident testing positive for COVID in the county. So since then, really the governor's edict around the pause order, and that was reducing, in pretty short order, it reduced the number of people that could be in a place, gatherings. It turned off non-essential businesses. And that was really the impetus to, I think, where we've landed now on the cusp of reopening. So since that period back in March, Wyoming County, throughout the duration of the event, has had 75 positive cases of COVID among residents in Wyoming County. What's important to know is a couple of things. Is right now there are 6 active cases. What does that mean? So let me, just for the benefit of the conversation, backpedal a little bit. When the health department receives a laboratory confirmed case of COVID, the health department takes action and issues an isolation order. Effectively, what that does is it places the diagnosed individual into isolation, which means limiting their exposure and interaction to individuals who are well. For most people, that occurs in the context of their own homes. And as part of that positive case investigation, if you will, health department epi staff are then also doing a pretty detailed interview, if you will, with our positive case to understand where they've been, the people that they've come in contact with, particularly the 48 or so hours prior to the development of symptoms. So that's a little bit of that contact tracing that we've been hearing about since the governor has announced the reopening plans. So, as of today, as of Friday, actually it was, there are 75 cases that have been diagnosed, 6 active. And do either of you have anything to add on that?
Yeah, as part As part of that, Scott, shortly after Chairman Davis declared the state of emergency in Wyoming County on March 20th, 19th or 20th, an emergency operations center was formed in Wyoming County, basically to look at the needs of the county and to assist as needed. Part of that was looking at the needs of the Wyoming County Community Hospital System, as well as the operations within the county government, as well as looking out into the business and agricultural community to help identify needs or concerns. Since March 20th, and it's still activated, we have been working on a number of issues, and I think there has been resolution to some, but we're at a point now where in the last few weeks, a human service portion has been spun off of that, as well as the Restart Wyoming County now is spinning off of that as the phases are coming back into operation. But there was a very active group of individuals, essentially from March 20th through today, still working on that emergency command center. So I think that proved to be very beneficial and helped out immensely, especially when you look at some of the issues that were out there with the health system where PPE was in short supply and hard to source, where we ended up assisting with that need and other issues throughout the county. Dr. Collins, did you?
Yeah, I was just going to comment on the active cases. Basically, when we have a case and they're isolated, then they're quarantined for an appropriate amount of time, which has varied somewhat over the course of this whole process. But once they are symptom-free and are removed from their isolation, then they are no longer an active case. Just to clarify that. So right now we have 6, as Laura said, 6 active cases that we're following right now that are isolated.
And 63 have moved over into recovery phase. So
I think you actually have that chart there, don't you? That mapping, the Genesee, Orleans, Wyoming. Maybe that'd be good to show that just to give an idea.
I can bring that up right now. Oh, nope, that one.
right. So this display of data was actually undertaken cooperatively with Genesee and Orleans counties. And that's in addition to daily press release of data that's happening through the Wyoming County Board of Supervisors. But this is a good visual, and it helps us understand, the impact of incidents in the region, if you will. And Wyoming County early on elected to report positive cases by quadrant. And that was deliberate. We are a very small county, and some of our towns are extremely small on the census side. And our twofold desire, of course, is to protect the confidentiality of patients, but also to manage response of this event in a way that assures people have access to the information that they need to be safe. So I know that there were some questions right along on Wyoming County's decision around reporting. And if there are any other questions from this group, please do put them in the chat box and we'll be, try to answer them. I will point out too that Genesee and Orleans counties have spun up 2 pie charts that you see towards the right of this display. And they are differentiating between cases that are facility diagnosed in those counties versus cases on the community side. And it's specific to, and there's no definition here on what entails a facility. My understanding is that it's been residential skilled nursing facilities and the DOCS system and the immigration control facility in the Batavia area. We certainly have facilities like that in Wyoming County. However, we made a very deliberate decision to not use that pie chart because to my mind, every facility related case is still linked to the community. Each of those facilities has employees that live in our respective towns and villages and interact with their families and interact in community settings. And so I will share with this group, and this has been publicized, about 15% of the confirmed cases in Wyoming County were attributed to a residential facility.
Did you have results on this particular slide or?
I don't have any other comments on that.
No.
I think at this point, we should probably move forward to what's happened in the course of the last, I think, 10 days or so is the governor, in an effort to restart New York, took steps and divided the New York State by counties into regions. And those regions follow the Economic Development Council regions in New York. For the purposes of reopening, Wyoming County is in the Finger Lakes region. And the reopening plan is incumbent on a region meeting 7 metrics, and this data is consistent across the state. A region, in order to be eligible to reopen, has to meet each of those 7 metrics. And so it was announced during the week last week that the Finger Lakes region had in fact met those metrics. And those metrics are around things like infection rates, hospital bed capacity, ICU bed capacity, community testing, and the county's capacity for contact tracing. So we, in the Finger Lakes region, had a gold star, and the official reopening occurred last Friday. However, reopening, in an effort to make sure that it's just not one grand free-for-all, if you will, has been divided into phases. And the phases for reopening, phase 1, construction, agriculture, forestry, fishing, hunting, retail, limited to curbside or in-store pickup or drop-off, manufacturing, and wholesale trade. My understanding is that there is to be a minimum of 2 weeks in between each phase of reopening, and the purpose of that 2-week period presumably is to monitor those metrics on the dashboard to make sure a region isn't seeing an uptick in infection, a decline in available hospital beds, or that community testing is not occurring as robustly as it should. So, this is the first time I'm going to say this, but this is my takeaway, if there is one, is that as we commence reopening and hopefully move through these phases, that the attentiveness of our residents and the businesses to this process and to maintaining some of the standards and good practices that we need is going to help us make sure that we can continue to move forward through reopening. And I'm talking about, the social distancing aspects, good hand hygiene, protective equipment if you cannot maintain that 6-foot separation break. But I'm also talking about a system to monitor the health of your employees and refer them for testing if they're experiencing symptoms. So we each have a responsibility as these phases unfold to be diligent so we don't backpedal, I guess.
And I think it's important to mention, Scott, that in addition to, noting these 7 matrix, that as these phases start reopening, if any of those matrix start coming out of compliance, so to speak, the potential is there that they could stop that redevelopment or that reopening portion of it. So it's just to reinforce what Laura's saying, it's crucial that we still maintain these good habits and practices that we've been hearing about for the last month and a half, because it's crucial that we, as we move forward, we're able to maintain those 7 matrix through this process.
Scott, that actually is exactly the dashboard I was thinking about earlier. And it does show that not every region in New York State has hit the metrics necessary to reopen. And, the governor has been very specific about, making decisions based on data. And I will echo what Steve said. If we see an increase, an uptick in infections or any of those metrics fall down, we can fully expect that reopening progress will be slowed until we come back into alignment. So this is the call for everybody to do their part.
Each region has a regional board that basically is overseeing this, and they're kept updated daily, if not twice a day, as to what those levels are and if there's any concerns on any of them. So again, our regional board, our representative is Chairman Davis on that board, but they're basically updated every day as to our status on those matrix.
So
go ahead.
no, go ahead.
Well, there's some questions still on the data that I've gotten on the side while we're on that topic
Okay.
of data reporting, and I thought maybe I'll throw a few out and then see if you can answer those while we're here, and then we can keep moving on to go on to the planning phases and some other topics. Some of the questions are, why does Wyoming County provide less information publicly or through these sites than other counties in the region, as far as the data goes? And let me just see, is there a rationale for keeping that information not as public as other counties have provided it by town? I think you did mention a little bit as far as health privacy. And wouldn't that information be helpful if that information was shared, especially as businesses are opening and employees and people knew where people were more positive or less positive as far as the testing goes?
Okay.
That's a lot. One question.
That's a lot. So let me sort out a little bit. The decision around reporting by quadrant is something that we discussed in detail, and it's been a continuing conversation to make sure that the information that's being made available to residents is transparent and appropriate. And we settled on the quadrant decision being most appropriate for Wyoming County.
Yeah, and let me comment on this. We have had a lot of discussion on this from the very start of this issue. And if you look at it from even a national perspective, there has been a lot of discussion across the United States on how much information, what type of information to release. And there's no clear gold standard. So it's really very, I think, community specific. And our primary two overriding goals, as Laura had mentioned, one is the public health and the safety of the public, as that's part of what we do. But we also have a commitment to an individual's right to privacy and their wellness and balancing those. So we've made the decisions we've had based on sound public health practice and what we felt, the information that we felt would be necessary for people's safety, in public settings. And there's a lot that goes into this decision. There are different decisions that are made based on the type of virus. Say a hepatitis A issue is a very different scenario than a pandemic SARS virus. The other thing is our community makeup. And we talked about, again, early on, a lot about this and people's specific privacy, which it's important, one, just from a privacy standpoint, but there are other reasons from a public health standpoint, too. If you think about if we said, really released information that there was a 26-year-old female in Bliss that was positive. Okay, we basically essentially just identified that person, at least to the people in the surrounding community. And from a public health standpoint, that level of information isn't really helpful in protecting ourselves, because really, whether somebody has it or whether they don't, you have to assume it's present everywhere, and as an individual, take the appropriate steps necessary. The other two issues is, on an individual standpoint, there have been people regionally that have received death threats because their information has ended up getting identified enough so that they could be picked out as an individual. And then the other one, on the other side of it, is that we've also seen in other infectious disease type of scenarios that we've dealt with locally even, is if people feel like they're going to be singled out in any way, then they are disinclined to actually reveal that they have the disease. They may choose to stay at home, weather out the symptoms, and not get testing so they're not identified. And then we have no way to do any contact tracing, follow up on potential leads and contacts from that standpoint. So there's a lot more that goes into this decision than immediately meets the eye. And again, it has to be done on a community by community basis. We're similar, to some of the counties south of us, Allegheny and others, Genesee somewhat, Livingston is a little bit different, but we all took a look at our local scenarios and made decisions based on that. And we still, I stand by and we stand by, the decisions we've made as far as balancing the need for privacy versus protecting the public. And the decisions we made, we believe, really support, the public's health and the safety of our community.
Okay. All right. Let's see. Did you want to move on to, we can maybe come back to some other questions towards, I know there's some that are duplicating that are coming up, which is good because we can look at those as we start to move on a little bit. Do you want to talk about the importance of formulating business plans and get on that topic of what is required, some of what we've learned recently of what's required? We didn't have a lot of guidance to begin with, and started putting up templates and other things to try and help guide people. And then last Thursday, the state put up some new information in a self-certification process. And I wonder if you might want to talk about that and why planning is important.
As part of the reopening process, each business is going to be obligated to formulate a plan addressing all the issues you can think of with the COVID-19, whether it's disinfection, social distancing, masking. How are you going to evaluate employees coming in or potential customers coming into your facility for illness? As you mentioned on Thursday, there were some templates that were issued under the phase 1 guidance. I think you are going to see similar templates for every phase as they reopen. But again, we've been talking to businesses over the last 3 to 4 weeks, advising them to develop a plan. And if you look at that template, a lot of the guidance that we gave out 2 or 3 weeks ago is still relevant. It really gets back to how are you safely going to operate this business under these new restrictions or these new things that are facing us. So again, with these templates, these business plans, they don't necessarily have to be reviewed and approved by any one individual, but you have to have them available if asked. And I think it is extremely important that and again, we get complaints every day from people not following the rules, so to speak. So it's going to be very important that you have these plans in place, not only to demonstrate that you've thought about this, but also these plans available for your employees and customers as to how you're going to operate your business. So again, if you have not started that, definitely get started on that, because that will be a requirement as we move forward. Along with that, there is also a certification or affirmation page that you basically have to read. And I think, Scott, you were showing that, right? It says read and affirm. Along with that, each business owner is going to have to basically read this 7 or 8 page document, basically setting out the rules, so to speak, and the guidance. And at the end of it, submit that you have read it and agree with it. What this is basically doing for the state is they're, just assuring that the businesses are looking as to what the bare minimum requirements are going to be. So it's important that, again, each business do this. This not only applies to new businesses looking to reopen, but this also applies to any businesses that never really closed and maybe were considered essential. So if they have not done any of these plans, they need to be also starting on those. Again, we're not returning to that old normal. We're going to start returning to a new normal, and you're going to have to evaluate that and address that accordingly with these plans. So it's very important that you get started on these if you have not, and get these in place.
And the elements of a successful plan really are, it's the business owner. These templates are great and they're useful, but each business owner is really in the best position to craft a reopening plan, because your business far better than anybody else does. The number of employees, your hours of operation, your employees' ability to social distance from each other and from customers, whether or not you're going to have amended hours of operation, or if you're going to run by appointment only. So there are a lot of different considerations to be made here. regardless of the specific considerations, though, there are elements that should be part of every plan, really. That is the social distancing, maintaining at least a 6-foot separation distance between employees and members of the public. Otherwise, both parties should have face coverings. And you'll hear me use face coverings as opposed to masks because it's relevant in different settings, which is being used. Business cleaning and disinfection, I think, is very relevant, and making available to your employees, the specific PPE necessary to keep them and your clients that you serve safe. That would be hand sanitizer and those face coverings. So,
along with that, the social distancing and the face coverings, it not only applies to employees and customers or members of the public, that also truly applies back to the setting, the employee setting too. That if the employees can't maintain that 6-foot separation, then by rights, they should be wearing some face covering also. So as part of this plan, you're identifying those points that are considered weak and maybe adjusting the seating and or other things to improve your overall setting to ensure that that social distancing is occurring, and then proper face coverings when needed.
I have a question. Am I allowed to have a question?
I guess you can.
I have a question. So are businesses permitted to make the decision on whether or not members of the public or their customers will be excluded if they're not wearing face coverings?
They have that ability to do that. It's not required at this point, but as any business, you can make that a requirement for entry into your business to just be expected. I think you're going to see this though in some businesses, such as maybe barbers and salons and some of these where there's a lot of close contact, you're right in the person's face. I think it will be required, but those optional, those other businesses that are out there that maybe you don't have a lot of customers coming in or can be done differently. Again, you can make that requirement as part of that reopening plan.
Thank you.
Some of them will be required, I'm sure, down the road, but right now it's just optional.
So in talking about, we've talked about plans and we can get back to that, but we're talking about face masks right now and protection. That we've had a couple different businesses write in about, and some longer lists about questions I don't think you necessarily have maybe answers to yet from the state or a mandatory point of view, but there's still best practices perhaps, and there may be mandatory information coming, especially when we get to phase 2 where you get into more personal services like barbershops and beauty salons, nail salons, things of that nature. And you talked about masks, and will customers be required to wear a mask while receiving those services? Do you think, because we don't have anything written yet, and unfortunately a lot of the state's data doesn't come until they're actually doing it. So, you might get it a day or two before if you're lucky, but will customers be required to wear masks to getting those types of services? You don't know if they're mandatory yet. And I think you did already mention that you could refuse service if they didn't have the right protection on. You don't know anything, you've not heard anything about client waivers, walk-in appointments, and how soon can people start to maybe put their clients back on the books?
Well, a lot of questions there.
Yeah.
No, there has not been any specific guidance as to will those entities be required to have masks.
I would expect.
I would expect it though, when you look at the nature of the business where you're very close, when you look at barbers, dentists, any of those things where you're right in that face of an individual, I think it's going to be required in some manner. I haven't seen that, but my gut feeling is that you will see that coming as part of those reopening plans. So they might as well start. And really, I think the individual that's running those businesses is going to want that protection anyways. So even if it's not required, as an individual that might be potentially operating that type of business, I would think you would want that just to help protect you also. What was the last question you asked me, Scott? I kind of forgot the last one that you.
When can they start with, especially with those? Yeah, when can they start maybe thinking about that?
Again, they are included under phase 2. If you look at barbers and hair salons and nail salons, they are included under phase 2. And if you go by the, in theory, they would be opening in 2 weeks roughly. So near the end of the month in June. But also remember that matrix the 7 matrix that were identified earlier. If for some reason we fall out of compliance, those phases could be delayed. I guess, it's up to the individual that owns the business, but I would not do a full-fledged reopening initially, maybe sort of a soft reopening, so to speak, just in the event that they might have to cancel or postpone that first week or two, and also allows them to maybe develop their, the practices that they have identified in their plan, to work with those practices, see where those weak points are, and maybe adjust and modify accordingly before they really get back into that full-fledged. But also keep in mind, I know as part of the guidance, you're also going to have those, again, social distancing requirements, so that if you have a small facility that you cannot maintain the 6-foot separation while your customers are sitting there, then you may have to only allow 1 or 2 customers in at a time, or have them sit in their car, phone them and call them when they can come in. But again, just keep that in mind, that it's not going to return to the way it was 3 to 4 months ago. It'll be a version of that, but again, it's going to be a modified version. Along with that, as you look at these facilities and identifying the safety plans, look at the type of equipment you have. If you have porous equipment like cloth type fabric chairs, you might want to consider replacing them, because as any good disinfection, you're going to want smooth, cleanable surfaces that you can disinfect periodically. And, I've had a few phone calls asking about magazines and things like that. Those are all things that probably won't be included as part of your reopening. You're not going to want those types of things in your facility. Again, you can't disinfect them. So it's going to be reevaluating your entire procedure as to how you deal with customers and identify those weak points and get rid of them.
And I recognize too, from a business perspective, that, and I know this, that there are people in the community who believe that, the COVID response has been an overreaction. And, we see that even in our data. Our largest cohort of positive infections is individuals in their 20s. And, those are people that just I'm not making generalizations because my kids are in their 20s. Sorry, kids. But, perhaps people who don't necessarily take the threat of illness, or are not at higher risk for developing serious illness with a COVID diagnosis. Maybe people who are not maintaining social distance or wearing face coverings. This phase of response for this event is something that falls squarely not only on you all as business leaders in our communities, but on each of us as individuals to do the right thing. So that's just some 2 cents there.
Okay. Thank you. We have some other questions, and I sent these ones. I had these ahead of time to you. And some of these are business related questions about health screening, tracking, reporting of cases. This is from a manufacturer. Enacting a continuous health screening process for individuals to enter the workplace. What are the requirements versus recommendations? And continue tracing, tracking, and reporting of cases. What are the reporting obligations to the health department, other employees? And then is there liability issues associated with that?
So I'd like to start with the last part first. That's not clear to me. I don't have access to that information. That is a question that we've received over the course of the last week or 10 days. Liability around reopening, I don't know. So that would certainly be something that we should bookmark, looking for additional information as the reopening phases progress. The elements of a good employee health screening process, I will share with you what we're doing here at the health department. There is a list of questions that we have each of our employees answer upon report to work. And then they take a touchless temperature reading with a touchless thermometer, and then simply initial that they have met the health screening for the day. It's important that those sheets be maintained by the employer in a way that's confidential, because in the event we do have a positive case, that will be helpful to the health department to reconstruct who that positive case may have been in contact with in the workplace on the period leading up to diagnosis. With regard to employer obligations, if you have an employee who perhaps doesn't meet the screening criteria, I'm sorry, let me backpedal. The most important element here is to create a workplace where employees are not coming to work sick. And so I think that's something that each employer can reiterate to their employees is, you know, if you're not feeling well, if you are outside of the normal limits of your personal best, really assess what your symptoms are and determine whether or not you should be at work, or if you should be home, or you should be contacting your primary care provider. The employer's obligation in terms of notifying the health department, there really is none. Essentially, if you have an employee who is excluded and that employee has respiratory symptoms consistent with COVID, they should go get tested. And when that testing occurs, that laboratory test is reported to the health department. Did you have anything you wanted to add on that?
No, I mean, I think you know, as far as getting the employee tested, we're recommending basically people follow up with their own primary care provider if they have one. And we are working on developing additional testing resources in the community. That's an ongoing basis, and is the testing has been, you know, nationwide and statewide, one of the constriction points, if you will, in getting all this moving forward. And the testing is really opening up as literally as we speak in the next couple of weeks to get it available outside of the more restricted groups of people that we've had before.
Do you want to talk about the new testing resource that we have available?
Yep. There is a new testing resource coming online, actually. The federal government, through the Health and Human Services, has put out a grant and is working together with pharmacies in particular. There's been some mention in New York State of them working with CVS pharmacies. There's a pharmacy group called Health Mart, which is the pharmacy group that works with the individually franchised pharmacies, several of which we have in our community, two of which we have in our, well, three, I think, that we have in our community. One of those in Warsaw is going to start testing tomorrow. And that is basically the process is you go to this Health Mart website.
Well, it's actually doineedacovid19test.com. Scott, we'll make sure you have that link to share with participants today.
Yep. And you go on that website and you enter basically just some very basic personal information. There's a set of screening questions that are asked. And if you meet the screening criteria, you're issued a certificate that gives you a date and time for an appointment for a screening test. The screening will be drive up, so you'll pull up to a designated parking area. You basically open your window just a crack. You show them your certificate. They provide you with the test kit. The test kit is self-administered. You put the stuff back in the bag, hand it back to the person, and then you will be notified by email through this setup of your test results. We also, as a health department, will receive notification of the test results and will be following up on any positive tests. So this is going to be I think, an increasing resource for the community. And like I said, locally, this is going online tomorrow. So it will be one way to do that. The other good thing about this testing right now is there's no charge. It does not require that you enter any health insurance information or anything. And again, it's funded through a federal grant, which right now only extends through the end of May. Hopefully we'll see that extended beyond that. So that's going to be a big resource for our community from that standpoint.
Well, especially as businesses, move toward reopening, and it circles back to that employee health screening question that you had, is if you have an employee, not everybody is attached to a primary care provider or has the means to, submit to insurance or pay a deductible. This is a great resource. And, I don't know what the turnaround time on the test is, but this is a great resource for employees and individuals as we move toward reopening, and will help us understand what the prevalence of illness is in the community. So Scott will make sure to share that link with you in order to push outward to your member businesses.
Okay. And you said those are free tests. It's a website where you can activate it. Where are the tests available in all communities or in different where would they be where can you get them done? Do you know?
Well, right now throughout, through the independent pharmacies, our local pharmacy happens to be Sinclair's, that is a member of this larger organization. I think this organization has, 12 or more sites listed throughout the state. There's a few in the Buffalo area, Elma, downstate, and some various areas. So this is through this particular organization. It's called Health Mart, actually, is the franchisee. We will see more coming on through some of the other corporations as well. CVS, I know, is one that's slated to go up and running next as well. But right now, locally in our county, it's Sinclair and Warsaw.
That's because it's a Health Mart pharmacy, right?
Exactly. And you do not access it through going to Sinclair's or calling Sinclair's. This is all done through the national franchise company.
And I went online to the website to complete the screening process just to see what it was about. And it truly is very quick, really limited questions, and pretty simple to complete. So yeah. The process seems, it hasn't started yet, but the process seems to have integrity, and it certainly seems to be designed to make it as easy as possible for people to, complete that self-assessment online and get their appointment time and get tested. They're starting this tomorrow. So,
if you go to the franchisee healthmart.com, there's a spot on there where it mentions COVID testing, and you can actually get into this link that we're going to be providing you, but it takes a little bit more work. So we'll get you the direct link. But if you're interested right now, you just look up healthmart.com, and there's kind of on their webpage, there's a COVID spot, and you can get in it through there. It's not as direct though as what we'll be providing.
Okay. Are there other methods or places that you can get testing in the county besides that? Because that's new. Where else is testing being offered, and what's the process, and how do you get it? Can you get it without a prescription? Is there a cost?
Well, let me first speak to that. When we're talking about testing, there's the two kinds of testing, as I'm sure you've all heard. One is the actual COVID-19 testing that looks for infection itself or the virus itself. And that's what we've been talking about here so far. There's also antibody testing available now, which basically is an indication that you may have been infected with the virus at some point in time. The current antibody testing that's available is probably at least, you have to have been infected for at least 2 to 3 weeks, and if not longer. The problem with the antibody testing in general is we don't really know what it means yet. Whether you may have been infected, yes. Does it mean you're immune to reinfection? How long does it last? There's lots of questions surrounding that the scientific community is working on. That said, we do have antibody testing available in the county. It is available by prescription only. So you would have to get a prescription from your primary care provider, and then take that, and you can get it done through the hospital if you go to their outpatient lab testing. And that's for the antibody testing specifically. As far as the specific testing goes for the COVID, again, we're working through primary care providers. So essentially, to get that testing done right now, you have to be referred from a primary care provider or healthcare provider to get that done. And we have several resources in the community that we're working with that. And that's primarily for symptomatic patients or people that meet the specific essential worker criteria.
Is there a form? I know one of the questions that popped up, is there a form for when employees, when you're doing that screening, like that daily screening, Laura, that you mentioned, is there a form that you use that could be shared, or is there something? I know that on our website, we have a sample form of that with the questions on it that you can ask.
I can send it.
Oh, there is you have something that you could share?
I have what we've been using here. And so, it appears to be working okay. So I would be happy to share that. That's fine.
And you can employers legally take their employees' temperature as a requirement of in that daily sort of screening process? Can they require that?
I hope so.
Yeah,
I'm sorry.
that's a really good question. I think that there's not any clear answer to right now. And again, that comes down to the confidentiality piece that Laura had mentioned earlier, as far as collecting the information on the employees and keeping that as confidential as possible. Though from a purely logistical standpoint, it's very difficult not to have some sort of, available knowledge when you're doing screenings. But this question, as far as the legal standpoint of it, I don't know the answer to that, actually.
Okay. And I know there was one on the requiring people to customers to wear masks and the compliance, you requiring versus being at odds with your customers, and kind of not put you in a different in a difficult position. Is there any place that you can point to or could point people to where there is that mandate? I know that there's an executive order, but how much legal teeth is in that, so that if somebody came in and you said, you need to wear a mask if you're going to be in our store or at our business, and they say, no, I'm not going to, and then you say, well, then I really can't have you here. And they could be belligerent or something like that. What is the potential recourse for a business owner in that case? Do you know?
So I think we're going to know a lot more about that in about a week than we know right now. My impression is, so we're asking for compliance, and we're trying to do that out of people. Wyoming County residents have done a pretty stand-up job here. We look at Erie County, Monroe County, and certainly what the folks in the New York City area have been through. And, Wyoming County residents have done, by and large, a pretty good job. And we'd like that to continue for the health of all of our residents, and especially those most vulnerable. Having said that, there is on the New York Forward website how to file a complaint 24/7 online. There's a portal to do that. And if it's an employee to an employee complaining about an employer practice, I think folks are being referred to the Department of Labor on that side. What does that look like? I don't really know yet. Do you have any clarity?
Legally, I think all they could do is point back to that executive order that came out that said you must wear a face covering if you're not able to maintain the 6-foot separation. And that's really all you can go by at this point without further guidance.
Because the executive order doesn't really have a penalty associated with it, correct? It directs people to do that, but there's no really teeth in it. It's not like an or else. It says people that can't maintain the 6 feet should wear face masks, but it doesn't say or what.
Right.
We don't know what the or what
and we haven't gotten any additional guidance referencing that, Scott. But again, in a week or two, maybe we'll have some additional guidance on that.
I mean, I've seen, and I know people have commented that if a business was to get complaints, and this is the importance of the safety plan and having the plans in place and maintaining good records and things like that, that if New York State probably starts receiving a lot of complaints about your business or their issues, you probably are going to run into a difficult position as far as the state, if you're licensed, coming in and closing you down, right? Because you're going to, in the event there is a complaint, right, if it's made to the state, do you know if those are going to be referrals to the county health department or the codes department, or is it someone from the state going to come in and start investigating first?
Back about a month ago, the county was obligated to identify a contact person within the county structure that would receive those complaints. Don Roberts, who's our code enforcement officer, was that person designated in Wyoming County. The way that is working now is he gets all of those complaints initially. but they are being passed out to departments that may have jurisdictions, such as the health department. If it's a restaurant or campground type complaint, we would get that. Zoning complaints are being passed to the zoning officer. So again, you're going to see more of that. We still have that person designated as that primary contact, and then he farms it out. That's not going away. That'll stay there for, I envision, probably through this whole process.
Okay. For anybody in the room, is the health department going to be putting out any specific guidance to best practices for sanitation in the business? Is there one set or standard that you're recommending, or and that's whether you're looking at the state plan or a plan you've developed yourself? Is there any guidance eventually that you think you'll be issuing, as far as Steve, probably in environmental health, I would think?
Well, the guidance that's out there now is what we're referring people to. That's New York State Department of Health guidance for cleaning and disinfection, as well as their CDC guidance that's out there. We don't have anything additional to that. And going forward, those are going to be our resources as we point individuals to help develop their plans, use some of that guidance that's already out there.
So if a business were to use, and we've got these up on our website too, the CDC and the OSHA links and the guidance and the plans that they've, with the approved chemical usage and disinfectants and things like that, that would be a standard that you would be comfortable with should our businesses adopt those.
Yeah, yes. And again, also reference the New York State Department of Health webpage, because they have some additional guidance regarding the approved chemicals in New York State. DEC has that list out there, as well as to the steps that are needed for a process to disinfect a facility.
Okay. Do you know if there's any reasonable accommodation with regard to people with disabilities that can't wear masks? Have you received any guidance from the state on that?
No.
No, not at this point.
No, there is a statement out there, Scott, and I wouldn't direct you because I don't remember where it was. It says people aged 2 and over able to medically tolerate wearing a mask. Nothing more than that I'm aware of.
And I think that medically tolerate also is I've heard of some stories where there are individuals that, again, because of their condition, can't wear them, and they have sort of waived that. But again, I would just reference them back to that executive order, the guidance that's out there.
So you would have to just make any reasonable accommodation that you possibly could.
Again, however you interpret that executive order.
But there's been no hard and fast guidance that's come down on that either.
No, there isn't.
This is a good question about recording employees' temperatures, and if it is, it's a good practice, but would that fall under HIPAA guidelines for tracking and keeping and sharing that information? Would that be something that you would keep as a confidential employee file? Would you recommend having one person in the business? I mean, some businesses, they don't have HR departments, so you wouldn't have one person doing it, but you might have, the business owner doing it. And how would you best maintain that potential kind of pitfall for a business as far as the privacy issue goes?
So I think you hit on a couple of things, and businesses, by the way, can have some latitude to be a little creative based on the unique operational aspects of their individual businesses. So maybe it's a daily email to each employee with some screening questions, and maybe one of the screening questions that says, "Are you feverish today?" And then each employee might be required to respond by email, and that might be adequate documentation. Or in a larger workplace, maybe you identify, a single or 2 individuals responsible for coordinating the screening efforts. Those logs should be kept confidentially, either in the office of a supervisor or the owner or HR, depending on the nature of your business. So, there is no specificity around what is screening, but each business must develop a screening process. So, I'll send along the questions that the health department is using. The matter of a temperature check and log is an individual decision, that business owners need to be making. But I would urge you to be maintaining those logs for at least a 14-day period.
Mhm.
And the 14 days is because the distance between exposure and infection is thought to be between 2 and 14 days for COVID.
We had one of the written questions that came in about sanitation for pool areas, and do you know if they're going to be allowed to be open at any point, and is there any additional guidance about pools and swimming facilities as we get into the warmer months?
Well, we've heard that over the weekend, some of the beaches in New York State will be reopening, but pools are not part of that. We're anticipating pools will be part of that phase 4. Again, when you look at the guidance coming down from the state, they want economic regrowth without crowds, so to speak. I envision we'll get further guidance on the pools probably in 2 to 3 weeks or right before they reopen it. It's probably the latter, the way things have been going. But again, when you look at a pool setting with the use of bromine and chlorine, they are disinfectants. So I'm not sure there's a huge concern there. It's probably going to come back to crowd control around the pool more than the bathing and the possible exposure on the water, on the deck, those kind of things. Again, it goes back to with the bromine and chlorine being very good disinfectants. So it's going to come right back to the crowd control, I think, around the pool, but I fully anticipate that'll probably be under the recreation portion, which is under phase 4.
Okay, and we had another one as far as crowd control kind of. Will outdoor seating be considered separate to the indoor capacity limitations that may be imposed?
A lot of the same guidance still applies. If it's indoor or outdoor, you still have to maintain the social distancing. And if you can't, wear the mask. But I think one of the big things when you hear all the governor talking and some of the other guidance, they want to limit those large groups of people indoors or outdoors. Again, under right weather conditions, you can have the same problems outdoors that you can have indoors. So again, they apply universally. What you're doing inside will also be required outside at this point. You can see that with NASCAR and some of the other things that are starting to reactivate where there's no crowds in the stand. And they're talking about horse races and some of those things in New York State without crowds. Again, a lot of those things are outside. So you're going to see that same guidance occurring for the outdoor venues that you see on the indoor venues, I think. Mm-hmm. No official guidance, but that's just what we're seeing under some of the information that we're getting.
Okay. What are some of the best ways for people to continue to receive information or get information from the health department if there's changes locally? I mean, we get it at the state level, we see on TV, things like that, but is there any place that you can point to that's a good resource or reference point?
There is the Wyoming County Health Department website that we're going to be updating and trying to maintain that a little better. Again, over the last month and a half, a lot of us were drawn off in other directions, but we realized that that's a point that information needs to get out there. So we're going to be actively updating that, as well as if there's information that's relevant to the ag community or the business community, we'll be getting that information out to you, Scott, and or Joan Petson in the ag community. Just to make sure that information is getting out there. But we realize it's very important, especially now that updated information is available as soon as possible.
And
I think Steve, sorry, go ahead.
I just wanted to chime in with, one more piece of that is the county is continuing to provide daily, daily updates. They have mostly been around the statistics and some general information about, reopening, directing people to the New York Forward website. But the county also, and this was, back on March 25th, it became very clear that this was going to be a marathon and not a sprint, particularly as businesses shut down. And we're starting to see that even in the context of reopening, that we're going to continue to have some lingering, unemployment among residents. And so the county made a decision to spin up a response line. It's 786-8911. And that response line has been just to give residents a point in the correct direction for the services and information that they need that might not be readily available. And that's one of the things that we battled hard against during the entire span of this response is people saw it on Facebook, right? So it is super important to make sure that the information that you're receiving and acting on is good and validated information. So that raises a good point. But with regard to the response line, circling back to that, so there are some great things occurring in the community with regard to the United Way, Food Link, some of the food pantries, the mental health department providing some great resources for our residents, because we're seeing an increase in some, distress levels among our residents, actually increase in mental health concerns and substance use disorder, some food insecurity, and just, some worry at large. So as you move towards reopening, I would, and try to develop these plans, do keep in mind your employees, the softer needs, I guess.
Along with that, Scott, the county EOC developed a web or an email address, which is oem@wyomingco.net. And again, that's available if you have specific questions or concerns also, that will be sent back to the appropriate staff. Along with that, the EOC has received some shipments from the state of facial masks and a hand sanitizer. And that is also available to businesses on, again, first come, first serve. We have limited availability, but if they are in need of any of those products as they start to reopen, send that request into that oem@wyomingco.net email, and an individual will be reaching back to them and get some additional information at that time. So that's also available in addition to that phone line that Laura discussed earlier.
And the chairman puts out an email every day with the data and statistics. Is there a way for the general public to either sign up for those or to access those every day? Do you know? Yes, I know that they kind of get pushed out on
under the county homepage. They can sign up for notifications, and that is one of those things that they can sign up to get a daily either text or email, making them aware of that new press release that's out there. So again, they would just go to the wyomingco.net homepage and they can sign up for those notices there.
Now I know that Western New York, it was just announced that Western New York will be reopening tomorrow, I guess.
Wow.
This is late breaking news. Can service be denied to people from an area still on pause? So that's going to be a lesser question now because Finger Lakes and Western New York bump up against each other, and that'll kind of help alleviate that. I know that was a question that was asked in a news interview I did, and it was asked of some business owners, like, we don't want a bunch of people flooding here because we're open. But I don't believe that there was any ability to deny service if you're not from the area. Is that correct?
I think that's correct, Scott. That was always one of the big concerns when the governor was looking at these phased-in approach, that areas would be opening up and their neighbors would not, as well as neighboring states potentially, their residents coming in, and that has always been a concern, but there was nothing said specifically that they couldn't stop them from coming. But again, they just wanted to try to limit that control. Again, it goes back to, we have to maintain those 7 matrix. So we don't want to allow a lot of people in necessarily that maybe from a hot spot, so to speak, because that could skew our numbers too. But there is no official guidance saying that you have to stop them, so to speak.
No, but this actually circles back to the business owner's role as you devise your plans to creating good plans that maintain social distance and, for the protection of your employees and the customers that you serve. So those standards apply no matter where your customers or employees are from. So
if there's an occupancy limitation already or some other limitation that you're under, that would kind of supersede that. I mean, if you can only have 4 people in the business at one time or whatever the allowable limit is, it's already kind of covered, and you can stand on that. But also, isn't the pause order still recommends that even though a region is open, it still recommends that people, still limit social gatherings,
yes.
limit
Yes.
interaction, limit. That I think that there's a misnomer or miscommunication among people that we're reopened and it resumes some sort of normalcy that really isn't there still, that the pause order, there's elements still, the face mask piece, that's part of the pause order that really isn't part of the reopening. That's like a standard ongoing as far as the social gathering, because it still doesn't say that you can have larger group gatherings everywhere from church services to, meetings. And I think there's people that are planning meetings and things like that, that they think that, well, if people are 6 feet apart, we can have 50 or 60 people at a meeting. And that I don't believe that that's true.
No.
The pause order still is in effect, right?
Yeah, and this, yeah, it is. And that speaks, again, to not creating a false sense of security. By, saying one region is open and the other one is not open does not mean that you're any less likely to get sick in one place or the other. And again, ties back to part of our decision making regarding around reporting and identifying specific towns or that. That was another piece that went into that, is that if you say someplace has cases, well, then by implication, it means the other place doesn't, and I'm safe going there where I'm not safe at the other place. And that's not the case at all. It really comes down to, again, us as individuals doing the right thing, practicing the social distancing, the hand sanitizing, the mask wearing, and us as businesses also implementing those across the board and avoiding the large gatherings. Again, so even with the pause order lifted in certain areas, your point is well taken. It does not mean it's any safer to do any sort of mass gathering events or anything at all like that.
And I think this was reiterated on Saturday by the governor. One of the bullet points on his news conference was he stressed economic growth without crowds or large groups. So again, we don't want to see, those large groups, and those portions of that pause order are still there. Because that's a concern if you start allowing large groups of individuals into closed settings like that.
There was another question that came in about the occupancy level requirements and potential outdoor seating areas if separation can be maintained. If they don't currently have, I suppose, outdoor seating and they extend that or create that, is that a new occupancy look, or is that
That is a potential that's a potential new occupancy look. Number one, you might want to reach out to building codes and zoning to see if you're allowed to even do that. But again, it's not going to be treated any different than the occupancy load on the inside. Those same numbers will still apply outside currently.
Okay. I know somebody asked just about fireworks and the 4th of July coming up and gatherings. I think a number of them have been canceled already. And that's a lot of that is organizations doing that on their own. You're not getting involved in that. And I think that the gathering question we've answered a bit with the pause, that a lot of these things just aren't going to happen. Would you agree to that, or do you have any different information?
Looking at the current information that's out there, I would agree with that, Scott, at this point. Again, a lot of these larger venues, whether it's a festival or a parade or a fireworks display, it really gets back to, can they truly go without having these large groups of people there congregated in one site? And the answer right now is no. So I think it's questionable as to whether or not they'll be able to go this year, but I'm sure we'll get further guidance as we get closer to it's probably going to come out about a week ahead of time, which doesn't help the person trying to get that show in place. But unfortunately, that's the way it is right now.
And I wanted to touch real quick on the task force that the Wyoming County started, the Restart Task Force, really meeting in earnest last week or the week before, and talking about what the future is going to look like. And it isn't. There's a lot that's outside of our control, and I'm just addressing this to everybody listening. And then if you want to chime in, Steve, but the goal is navigating, informing, planning, and advocating for our county, our community, our citizens, residents, businesses, and such as we move forward. And there's a lot of things to look at. Again, we can be as proactive as possible. We have to be reactive to a certain degree, because things that are changing that are out of our control, and we can try to relay information and make decisions here as best we can. And so that's some of what we're looking at right now, is going down it. We're going to start sector by sector, looking at a plan and trying to understand, what we need to do to move forward. I think some of the questions that are coming in will be questions that we can, address in that task force as we move forward. One came in about, where information can be posted about virtual meetings for things like AA and like that. And that might be one we could refer to getting it over to, say, Partners for Prevention or something like that. If there's websites that perhaps they can take that information, or finding some central repository for information. I know there's a lot of sources out there. And then I want to touch on too, the business plans, sample plans. The Chamber website has a lot of those on there. The state forward.ny.gov also has, again, the new ones, and we won't know what the phase 2 ones look like probably until the state puts those up. We've talked to Empire State Development, and those are coming. They don't want to put things up too soon. That's been one of their concerns, is getting too much information out too quickly. I know that doesn't make sense because it's confusing to me, but they don't want to get ahead of themselves. And some of it, again, is happening so quickly that they don't have it ready yet.
I think that's the case. Yeah.
Yeah, and so that's what happened with the reopening phase 1. The list came out. We had more detail, which was great. And then we've been pushing plans and getting information out, OSHA guidelines, CDC guidelines. And then the state on a Thursday afternoon posted these buttons underneath each section, which just appeared. And then a press release came out and said they're there. And it was the first time that we got some really concrete information about what the state was looking for, so that we could start to advise people, well, okay, here's a framework for a plan. So start to use that. But there's great plans out there, that the state would accept. You know what I mean? Right now, they haven't said this is unacceptable or acceptable, but use their plan as a guideline, because clearly it's their plan and it's what they're looking for.
In addition to that, Scott, a lot of associations or groups that represent these businesses have done a lot of good work also, whether it's the barber industry, the campground industry, or the golfing association. A lot of those groups have also provided templates, and I think that should be recognized. And I think you have started putting some of that information out on your website also.
We do. And as some of our businesses have sent these, sent their industry sector information, because a lot of it is out there. We've been posting it to just share it, because the more people have, the better.
Right.
Because so many general plans, general ideas, but every business is so specific about how they operate, from, moving people through a store or seating or whatever it is, that there's every business is so diverse that, there's no one size fits all. But there are some good, solid plans out there that we can look to at least guide and get people in this. And things are going to continue to change. I think that's the hard part.
Yeah.
Business likes to plan. Business likes to know. And one of the hardest things is getting them, our business owners, and this is and then by virtue of people go to businesses and interact together, going out into the community needs to know. And I think the businesses, as they develop plans, will end up being leaders in their own right, because that will they're going to set that stage. They're going to set that norm and the new normal as people move forward. One question that I suppose probably should be clarified that was asked early on is you said that there was Dr. Collins, you said that there was a threat made against somebody for or about that wasn't made in Wyoming County. That's a you're referencing something somewhere else, weren't you?
Correct. That was an adjoining county.
Okay, I thought so, but I know that a member of the press asked it, and I just wanted to be clear that that was not here. That was someplace else.
That was someplace else, but it did inform some of our decision making. Yes.
Okay. Well, we're about an hour and 22 minutes in, and we've gone over, and you've been very generous with your time. Were there any closing comments that you wanted to make as a group from our health department before we start to wrap up here?
I don't have anything further particularly. I just want to thank you again, Scott, for convening this conversation, and to the businesses, I wish you the very best as we move through the phases of reopening. And certainly if you have questions, reach out to the chamber, reach out to the health department, and we'll do the best we can to support you.
I'd like to follow up on that. I appreciate this opportunity, Scott. And just so you know, we are available by phone, and we've been taking numerous phone calls and emails every day. But if you have specific questions for your business and would like some additional guidance, please feel free to reach out to us at the health department.
Yeah, I'd just like to say thank you to everybody as well for taking the time and reiterate we are here as a resource. Information's changing on a daily basis without a lot of warning about it many times. So we're here to work through this with all of you as we'll get through it together.
Well, thank you, Dr. Collins, and I want to thank all of you for taking the extra time this morning and having a conversation with about a pretty wide open topic that's going on right now. And to thank you that, people don't realize that, I know that I've talked to Steve on weekends, in the evenings. Laura's reached out. That this has been a team effort, and we're as frustrated at times, I know you are, that you can't get the information, and you're kind of left in a difficult spot, not always able to answer a question. And really, I think we're all trying to get the best information as fast as we can get it to the people who need it to make decisions. And I know that it's been a crazy couple of months now as we're talking about this, and that things are going to continue to unfold. And we appreciate the team that we have working at the health department, and our elected officials, and the folks that have been doing a lot behind the scenes that people don't really realize. I'm fortunate that we have some good interaction, and we have some good interaction on a regular basis. And I appreciate your ability and your willingness to take those late evening texts and emails and those things to try and get information out to our community and our business community. So I just want to thank you there. Say keep up the good work. We're all in this together, and that's it. If there's any questions, we'll look in the side there and see if we can answer any. And I know that Laura was going to send me some information, so we'll have a wrap-up email, and then we'll send everything back out.
Okay.
All right.
Thank you, everyone.
Thank you.
All right, great. Thank you, everyone, for tuning in. We had a really great turnout, and we'll see you for the next one. We actually have I should plug it, on Friday, the 22nd. And of course, I don't have the time, but it's it's in an invitation, and we will remind everybody. But May is Mental Health Month, and like this one, we had the health department team. On Friday, we're going to have the mental health department team talking about a variety of other subjects that will be affecting the citizens, the community, businesses, and how people start to get back to work and start dealing with some of the issues we need to think about. So with that, I thank everyone again, and wish you a good week. Thank you.
Thank you.